My name is Danielle and I'm 31 years old. Hi. Good, how are you?
Good.
I have a consult appointment with Dr. Tarowski.
Okay, perfect. Okay, if I can have you fill these forms out for me, and then when you're done, you can bring it up.
Okay.
And then I'll get Cece to take you back, okay?
Sounds good.
There you go.
Thank you.
You're welcome.
Why I want breast augmentation is just simply to feel a little bit more comfortable in my skin. I was a gymnast growing up, I was a dancer, and I started developing at a really early age, and they just didn't get any bigger. So for me, it's just feeling more, I guess, more womanly, just feeling more proportionate to my body. This is not me. This is Victoria's Secret. It's 2 cup sizes. And I mean, even with that, it gets expensive. I mean, you know, you spend $70 on a bra here and $70 on a bra there, and it's just like, that adds up over time, and it's just like, it helps, but it comes down to, at the end of the day, it doesn't really take care of, you know, the insecurities that you may actually have. So just a way to feel better about yourself.
My name is Dr. Gregory Turowski. I'm a plastic surgeon and the medical director of New Horizons Center for Cosmetic Surgery here in Chicago. I went through the training, first became board certified in general surgery through the 8 years of residency, and later on continued to have a residency in plastic surgery at Harvard University, and after that became board certified by the American Board of Plastic Surgery. And since then, since this is already 15 years, actually I went through another certification again, because that's what we have to do nowadays, recertify. So I have actually double boarded in both boards.
I didn't know what to expect coming into the consultation at all, and I mean, you're going to a plastic surgeon's office, you know, it's always nerve-wracking. And so I walked in, and I really had no reason to be nervous. Everybody was so warm and welcoming, from the receptionist to Cece to Dr. Tarowski. Everybody was just absolutely amazing, and they instantly made you feel like you were part of their family. You know, you knew that you were going to be taken care of. You knew that you were going to be in great hands. All of your questions were answered. It was just, and the minute I left, I mean, I had other consultations scheduled at other places, and the minute I left, I was like, I don't need to go anywhere, because it's like shopping for cars. You don't start with Bentley and then like go shop at like Honda. You know, it's just like you kind of started up here, and then I was like, I'm done, that's it. There's no other options.
Danielle. Hey.
Hi.
Hi. How are you? I'm Cece.
Hi, nice to meet you.
Very nice to meet you. Come with me.
All right.
The consultation itself is really interesting, actually. You sit down and you watch a video about breast augmentation, and then you come in and then you speak with the doctor, and it's more or less, you know, he informs you as far as the surgery, the different implants that are available, where to place them above or below, the different incision sites.
Let's take a look at you. Yeah, why don't you stand up and we'll see where you are right now. And okay, well, you have a typical situation. You have a small breast. That's why you're here. But they're very nice and symmetrical, and nobody's perfect, nobody's identical, but you are close to that.
One of the coolest parts about the consultation, I think every woman gets excited about, is when you actually get to see yourself. So there is a part where you get to put a sports bra on, and then you stick the little silicone things in, and you watch yourself upgrade with size, and that's just seeing that in the reflection and saying, okay, that's what I'm going to look like per se when I'm done, is amazing. And then you go and then you get your picture taken with this like 3D imager, and they instantly show you an image of you bigger. That is so awesome, and just being able to take that and say, wow, this is a picture of me, and being able to show that to your friends and your family, and just saying like, this is basically what I'm going to look like when I'm done.
You were thinking about 450, yes? Mm-hmm. And this actually, is the implant right here, and then we can view the results. and we can see how they actually expand and actually grow on you. So it's a pretty cool way to do it, and this is how it goes. You can turn your body and see how this actually fits you really well. Well, in Danielle's case, I think she's a great candidate for this procedure. She's mature. She thought about the whole process and operation for a long time. A lot of girls that decide to undergo breast augmentation, once they decide they want to do it, so that's not unusual that they come for a consultation and they really want to do it next day if possible. But that's not because they made the decision that day. They really made the decision over many months or sometimes years of preparations. But once they decide to do it and they find the right surgeon, they feel comfortable, they feel safe, they want to do it and they want to enjoy it as soon as possible.
So I just finished my initial consultation with Dr. Turowski, and I'm so excited. Just everybody here has been completely amazing, and they answered all my questions, and just the technology that they have and everything. The whole experience has just been so surreal and amazing, and I'm so excited that this is finally happening.
Hi, welcome.
Hi.
Lauren, I'm a nurse here.
Nice to meet you.
Nice to meet you too. Come on in with me and we can talk about a little bit about what to expect in private.
Okay. So the weeks leading up to my surgery, after my initial consultation, I went back in for my pre-op, where you basically sit down with the nurse who's going to be with you during the surgery, and the anesthesiologist, and just answer any questions that you have regarding the surgery, letting you know, what you can and can't take prior to the surgery, what to expect initially within the few days after the surgery, and just answering any final questions and just making sure that you're prepared for it.
But it's always important to walk right after surgery.
So she decided on the procedure that actually I like the most, the axillary approach. It's an endoscopic surgery. It's done through a small armpit incision versus other choices that are available. My opinion is that this is the best surgery because it leaves no scars on the breast, and that's really why she's here, to have a beautiful breast, and if you have even minimal scars, it distracts from that.
What I'm looking forward to post-surgery is flaunting them. Just being able to wear the clothes that I want to be able to wear. I don't wear dresses right now. There's a reason why I don't wear dresses, because they don't fit me right. I'm a certain size down below and I don't fill them in on top. Even if I wear, a bra, they're still there. It's just being able to do certain things and go places and just have, know that you're going to stand a little bit taller every day, and just kind of not like, hey, but you're just going to have that added confidence that you didn't have before. This is something that I have talked to my sister and my family about for 13 years now. And sorry, just finally getting to a point where, it is happening. It's like, you can't even describe it in a way. It's just awesome. It really is awesome. So it's the day of, and I'm tired. So just kind of freshening up, getting ready. Got to bed about midnight last night, so I'm at about 4.5 hours of sleep, so definitely really tired. But I think excited trumps tired at this point, so time to get ready to go. Let's do this. The morning of the surgery, I still was in disbelief, even that it was happening. The whole ride up to here, I was still just like, I can't believe this is the day. I can't believe that it's finally here. And it was still more or less shock and awe, I guess. Because now we're getting close. So now it's like, nerves are starting to set.
Danielle, hi. Good to see you. Welcome.
How are
I'm good. How'd you sleep? Yeah.
It wasn't until I'm in the room and I'm in the dressing gown and they're giving me the IV and they're explaining everything that the nerves started to sit in. And as exciting as it is to get something that you've always wanted to, it's still surgery and it's invasive surgery, and so your nerves, you know.
Hello, good morning.
Hi,
Good morning.
good morning.
Yes, how are you doing? I see that your IV is already started, so that's great. You know, so that's probably the most painful moment of the morning because it's a little needle, but actually it's not too bad. So do you have any questions left? I know we had a lot of time to discuss this procedure, but sometimes you have last minute questions or anything.
I don't think so. It's just now it's nerves. The minute that they laid me down on the operating table and they're like, God, you are nervous, because I was literally shaking. And they're like, just take deep breaths. And they're like, okay, you're gonna count to 10. And I'm like, okay, 1, 2, gone. And out. And then the next minute I'm awake and there we go.
You all ready?
Yeah, ready.
All right, good.
Ready.
Okay, you look great in that hat. Come on, young lady.
Styling.
It's gonna be nice and toasty warm,
That's what stepdad
too.
would say. He's styling and profiling.
Styling and profiling. Here we go. I like that. I like that.
Everything went really well. Daniela is doing great, and she's going straight to the recovery room. You know. Yeah, the day of surgery was great. I mean, she came on time, and everything we started on time, which is always good. And it actually was an excellent procedure. It was completely without any unexpected situations, and as they usually are. These are procedures that are very streamlined. We do a lot of them, so they have to work out all right, almost every time. And I always compare it to taking off from the airport. We have to be on time on every part of it, and most of the time it is. So she did great, and she didn't have any complications or any unexpected problems. Quickly recovered. Was in the recovery room just for a few minutes, not within an hour. She was ready to go home.
Directly out of surgery, I wasn't in too much pain, right initially, because you still have the pain meds in you, and you're still on anesthesia, so you just feel extremely worn and just tired, and even getting it in and out of the car is just like, it exudes every single piece of energy that you have. And it took basically, I think, 2 people to even get me in the door when I got home. To have the bandage come off and see yourself for the first time, when I looked in the mirror, I cried. I'm a crier. But no, it's a life-changing, there I go. It's a life-changing event, and to see it finally happen it's like I did it, and it's like you accomplished something of some sort. But it's just knowing that moving forward, and every day and every week from there, your life is going to be different.
I always tell everybody that they will be able to drive a car and maybe go even back to office type work in a couple days, and that's what usually happens. But that doesn't mean that things are done, and I think that they check themselves every day, several times a day, looking at the changes and how they feel. And what's nice about this approach that we utilized here is that usually they have minimal amount of bruising from this axillary incision, and so at least that's not present, or very minimal. So I think that psychologically helps. They feel less injured from the procedure itself.
So how are you today? I'm good.
Excellent.
Excellent. Doing okay? Feeling good? Beautiful.
Back to work, so it's always fun. Coming in here 1 week post-surgery, honestly, it feels like it's been forever ago. But just the difference that you see from 24 hours to 1 week after is hugely immense. You know, when they take the bandage off and everything is super high and super tight, and just within 1 week, it starts to settle and it starts to drop a little, and it's just you kind of are seeing, okay, this is where it's gonna. I can see some differences.
Hello, Danielle.
Hi.
Hi, how are you?
Good.
So, how was the first week after surgery? Yeah,
Good.
You did all right?
Yeah.
Okay.
Survived.
3 days after the operation, I went back to work, and I manage a retail store, and most people probably would have taken more time off, but it's possible. You just have to know your limitations, and you have to listen to your body.
Hello, how are you doing? Yes. It's been a month, yes?
Yeah.
Okay, so how is your life? A little different now?
It's good.
Good? Okay, good.
Yeah.
So you're getting used to new clothes and everything?
Yes.
Good.
New clothes, new bras. It feels longer than a month.
At this point, she can wear all clothes she wants. She can, actually feel comfortable going out and, wearing different type of outfits. So I think she feels like she's back to life. She can go to the gym, she can run, pretty much do everything. So there's really no more restrictions on any activities. And I think the only thing we are waiting for is to have the final shape, which really is a minor difference. So at this point, I think most patients are really happy with the appearance, with how the things went, and they feel safe and secure that everything is doing well.
The last thing that I would have to say is just a huge thank you from the bottom of my heart, because they've been so amazing. I mean, just everything is, like I said before, it's priceless. You can't put a price on it, and they're just phenomenal, phenomenal people, phenomenal environment, and I tell everybody.